In the world of veterinary medicine, just like in human medicine, we are facing a growing challenge with antimicrobial resistance, where bacteria become less susceptible to the drugs we use to fight infections. This makes treating these infections increasingly difficult. To combat this, many hospitals are implementing antimicrobial stewardship programs, which involve strategies like establishing guidelines to ensure antibiotics are used appropriately. When they looked at the reasons for prescribing these antibiotics, they found that gastrointestinal issues and respiratory tract problems were the most common reasons overall. However, there were differences between dogs and cats. In dogs, respiratory and gastrointestinal problems, along with skin and reproductive tract issues, were most frequent. In cats, urinary tract infections, followed by gastrointestinal and respiratory problems, and ear, eye, nose, and throat disorders were the leading reasons.
One of the key aspects of responsible antibiotic use is performing bacterial culture and susceptibility testing to guide treatment decisions. The study found that this testing was done in just over half of the cases overall, with a slightly higher percentage in dogs compared to cats. When they looked at the types of samples being submitted, urine, skin, and blood were the most common. Importantly, they found that bacterial culture and susceptibility testing was performed more frequently after the hospital's antimicrobial stewardship guidelines were introduced.
In a significant number of the samples where bacteria grew, the researchers identified antimicrobial resistance, meaning the bacteria were not killed by certain antibiotics. In some cases, they even found multi-drug resistant organisms, which are resistant to multiple classes of antibiotics.
Now, let's get to the crucial part. How well did the antibiotic prescriptions align with established guidelines? The researchers assessed adherence to both the International Society for Companion Animal Infectious Diseases guidelines and the hospital's own new guidelines for common infections. For respiratory diseases, they looked separately at upper respiratory infections and aspiration pneumonia. They found poor adherence to published guidelines for upper respiratory infections, mainly because doxycycline, which is often recommended as a first-line treatment, wasn't used. The treatment duration was often incorrect, and sometimes antibiotics were prescribed even when signs like fever or lethargy were absent.
For aspiration pneumonia, adherence to the hospital's guidelines was better, but most cases did not follow the published guidelines, often because culture and susceptibility testing wasn't performed, the wrong antibiotics were chosen, or not enough diagnostic tests were done.